Today we're going to be discussing the person's rights, which is Chapter 2 in your textbook. The Patient Care Partnership, Understanding Expectations, Rights, and Responsibilities, is a document that explains the person's rights and expectations during hospital stays. This document was developed by the American Hospital Association. It stresses the relationship between the doctor, the patient, and the health team. Patients are entitled to high-quality care, a clean and safe setting. They are entitled to be involved in their care. They are entitled to have their privacy protected, have help preparing to leave the hospital, help with bills and insurance claims, meaning the hospital will file claims and the hospital will try to find financial help or find other arrangements if a patient is unable to pay. Residents' rights. So OBRA, if you remember, is a federal law that applies to all 50 states. It's enforced by the Center for Medicare and Medicaid Services. It requires that nursing centers provide care in a manner and in a setting that maintains or improves each person's quality of life, health, and safety. Nursing assistant training and competency evaluation are part of OBRA. Resident rights are also a major part of OBRA. Residents in nursing centers retain their rights as U.S. citizens. Residents have rights related to their everyday care and life in the nursing center. Nursing centers must protect and promote the person's rights. The center cannot interfere with the residents' rights. Nursing centers must inform residents of their rights orally and in writing. Residents are also informed of the rules about their conduct and responsibilities in the center. This information is given before or during admission to the center, as needed during the person's stay, and when laws or center rules change. Rights and information must be given in the language and format that the person uses and understands. So for instance, with an interpreter, written translations, avoiding medical terms, using sign language if required, and large print text. Residents who cannot represent their rights have representatives. A representative is a person with the legal right to act on the patient's or resident's behalf when he or she cannot do so for him or herself. There's also something known as an ombudsman, which is a person who supports the needs or interests of another person. Residents have the right to information. They have the right to access all information about themselves, the right to be fully informed about health conditions, and the right to have information about their physicians, the name, contact information, and specialty. All information about the person refers to medical records, contracts, incident reports, and financial reports. Residents can request information either orally or in writing. It is important that the CNA report any information requests to the nurse. The CNA does not give out information to the family. Residents also have the right to refuse treatment. Treatment is the care provided to maintain or restore health, improve function, or relieve symptoms. A person cannot be treated without consent. An advance directive is written instructions about healthcare for when a person is unable to make healthcare decisions on their own. If a person refuses treatment, the center must find out what the person is refusing and why, explain the problems that can result from the refusal, offer other treatment options, and continue to provide all other services. The CNA must report any refusals to the nurse. Residents also have the right to privacy and confidentiality. Residents have a right to personal privacy. Staff must maintain the privacy of the person's body. Only staff directly involved in care should be present. Consent is needed for others to be present. Privacy must be maintained for all personal care measures, which include bathing, dressing, and elimination. It's important to close privacy curtains, doors, and window coverings. Remove the resident from public view. Provide clothes or drape the person to prevent unnecessary exposure. Residents have the right to visit and make phone calls in private. If requested, the center must provide a private space. The resident has the right to send and receive mail without others interfering. Unopened mail must be given to a person within 24 hours of delivery to the center. Outgoing mail is delivered to the Postal Service within 24 hours on days of regular delivery or pickup services. Information about the person's care, treatment, and condition are confidential. Consent is needed to release this information. Residents have the right to personal choice. Personal choice promotes quality of life, dignity, and self-respect. Examples of personal choice are choosing doctors, choosing friends and visitors, helping plan care and treatment, choosing activities, making their own schedule, and being informed about care. Residents have the right to voice grievances. Residents have the right to voice concerns, questions, and complaints about treatment and care. A patient cannot be punished for voicing a grievance. Residents have the right to participate in resident groups. They have the right to take part in social, cultural, religious, and community events. Residents have the right to keep and use personal items. The items allowed depend on space needs and the health and safety of others. It's important to treat the person's property with care and respect. The person's property is protected. Items are labeled with the person's name. The center must investigate if an item is lost, stolen, or damaged. The CNA should not go through a resident's closet, drawers, purse, or other space without the person's knowledge or consent. A coworker should be present if an inspection of personal property is required. Residents have the right to be free from verbal, sexual, physical, and mental abuse. Residents have the right to be free of involuntary seclusion. Involuntary seclusion is separating a person from others against their will, keeping the person to a certain area, keeping the person away from his or her room without consent. Abuse is the willful infliction of injury, unreasonable confinement, intimidation, or punishment that results in physical harm, pain, or mental anguish. Depriving a person of goods and services needed for well-being is a type of abuse. The word intimidation means to threaten to hurt or punish. Centers cannot employ a person who has been found guilty of abusing, neglecting, or mistreating others, have a finding entered into the state's nursing assistant registry about abuse, neglect, mistreatment, or wrongful acts involving the person's money or property. A finding means that a state has determined that the employee abused, neglected, mistreated, or wrongfully used the person's money or property. Residents have the right to be free from restraint. What that means is they have the right not to have body movements restricted. A restraint is a device used to limit a patient's movement. Physical restraints and certain drugs can restrict body movements. A physical restraint is use of a device to restrict freedom of movement on all or part of a person's body. A chemical restraint is the intentional use of any medications to subdue, sedate, or restrain an individual. An environmental restraint is a change or modification of a person's surroundings to restrict or control a client's mobility. A doctor's order is needed for restraint use. We'll discuss restraints more in an upcoming chapter. Residents have a right to quality of life. The term quality of life is a concept that aims to capture well-being. Residents should be cared for in a manner that promotes dignity and respect. Dignity is the sense a person has of their own self-importance and value. Residents have the right to a safe, clean, comfortable, and home-like setting. The center must try to change schedules, call systems, and room arrangements to meet the person's desires and needs. For instance, if a person prefers a shower over a tub bath or wants a shower before breakfast, the center must be accommodating. If a person is uneasy about a staff member providing care, the center must try to give a different staff member to that patient. It's important that the center works to make sure that the patient can reach or use their call light and can reach personal items. The resident also has the right to activities. Residents have the right to activities that enhance each person's physical, mental, and psychosocial well-being. Religious services are provided in the center.